Hey everyone, Phil Plisky here from Functional Movement Systems. I have Jenna Gourlay, who's one of our Functional Movement Systems instructors with me. We're talking about telehealth and some of the insights we've had and maybe some of the problems we've encountered. And I thought it might be beneficial for everyone to hear this. What I found in doing some telehealth is it was surprising how I felt like my hands were tied behind my back. I mean, I really, do a lot of joint assessment. I do a lot of manual therapy, and obviously in telehealth that has gone away. So at first I felt really, really kind of just at a loss, but very quickly what I recognized was that having a system and having the selective functional movement assessment really allowed me to still be able to provide high quality care in maybe a little bit more challenging setting. What have you found?
Yeah, I felt very similar when I did it like the very first time. And I was really excited. I'm like, all right, I'm going to go through the breakouts. I'm going to do all this stuff. And the second I started, I kind of had this moment where I was like, oh gosh, like this is going to be way harder than I thought. But as I got into it, I realized it wasn't as bad as I was expecting, because these are patterns and these are movements that I've seen thousands and thousands of times. Usually I follow up with getting to put my hands on them, but even in the absence of that, it's still very familiar because, again, I've gone through the systematic way of doing it over and over and over again. So it did feel awkward in the beginning, but it definitely got easier as I kind of got farther into it.
You mentioned patterns there. I really found that I was maybe more aware of the patterns that I naturally kind of rely on. A lot of people who I do mentoring with, a lot of times they'll say, I see what you did and I understand it. It makes sense. I don't know how you got there though. It seemed that I was more aware of the patterns that I use since my hands weren't involved. Are you finding the same thing?
Yeah, so like a good example for me was I was doing it with one of my volleyball players, and she's pretty far out from a patellar dislocation, and she'd been having knee pain as she was getting back into her sport specific stuff. And I would start looking at her patterns, trying to figure out, what's driving the knee pain. And I start to see the pattern that her right rotation is out. And then as I get to breaking out her hip extension on her left side is out. So she's an outside hitter hitting with her right hand. When I see that, I know that going up into that position, those two things together could very well be contributing to her knee pain. And it's kind of like you're playing a little bit more of detective. So, you're talking about how you can't put your hands on the person, but I think there's a lot of contextual things that can help us there.
Absolutely. Absolutely. Now, so, you mentioned a volleyball player, this is someone you've seen before and things like that. I've done it with patients I've seen before. How does it change when maybe telehealth is the first time that you're seeing the person? What have you found there?
A few tips I would give. The one is if the person can have someone else with them, that helps tremendously. It helps for a few reasons. It helps because eventually you're going to have to see if something is a stability problem or a mobility problem, and you do need somebody else's hands to help you do that. The other thing is that they can move the camera to give you a better angle. So I first found that this was a problem when I was looking at hip extension. I saw them from the side and I could tell, okay, that broke parallel, but I wasn't getting that bird's eye view to see if it was going laterally at all. So definitely having a second person helps. And like I said, there are context clues. So for example, with that volleyball player, can't come to find out, like now she has locked up T-spine in some way, right? Well, she's a high biting person. She's almost, got biting like 8 out of 9. So, I'm not thinking it's so much joint in that case. I'm starting to think, okay, maybe it is a stability problem, or, maybe it's driven more from like a tissue or a soft tissue problem. Another thing that helps is if you're looking at, say, the hip, right? And you look and you see the person's restricted in external rotation in prone on their stomach. But then you don't see the same thing in sitting, and you don't find the same things when you're looking at hip extension is good, hip flexion is good, internal rotation is good. Well, if the rest of that hip joint is showing good motion, okay, then I'm starting to think maybe that is another soft tissue problem. And the last thing that I would say, probably least important, but still valuable, is what sensation the person's feeling. So I'm looking at a person and they have restricted closed chain dorsiflexion. Well, if they tell me, ooh, I feel a stretch in the back, that's a little bit different than if they say, oh, I feel a pinch in the front. Now, I don't know that the pinch is necessarily joint unless I can feel it, but I have a better inclination, I'm thinking maybe it's more joint than it is soft tissue.
Sure. So more of a percentage play there at that point in time, and almost using the patient's report as your hands
Yes.
to be able to get some more information. Well, this is great. This is, I think, really helpful. I don't know that telehealth is something that I would want to do 8 hours a day every day. It's I definitely miss that interaction with the patient, and I definitely do like doing all my hands-on treatments. But it's really opened up a lot of avenues for me in when someone goes off to school, or someone does live a couple hours away and they're coming to see me, or flies across the country to come see me. It's a lot easier to see them that first time and then just go, hey, we're going to check up with you weekly here, do that. So I think telehealth is here to stay, and I'm very thankful that I have a system for it. So thanks so much for your time, Jenna.
Yeah, definitely. It was great.